Welcome back into Everyday Kentucky. We're here at UK HealthCare Orthopaedics with Dr. Scott Mair. Doc, how many years have you been working with the basketball team?
I just finished my 24th season working with men's basketball.
Wow, how many coaches was that?
That's 4.
4, at least, right? What you do with the basketball, what exactly do you do? Because I see you doing all kinds of stuff.
Well, obviously it depends on the day. You know, all of us, we have 9 physicians and a bunch of fellows that take care of the UK teams.
Sure.
There are 23 different teams. Specifically with basketball, you know, we do everything from all the sports. We take care of the pre-participation physicals all the way up to training rooms where we see little minor injuries and things. More urgent things, we'll see patients in our clinic, obviously. And then there's game coverage, and then occasionally we have to do surgery on these athletes. That's not our goal, because we want to keep them on the court and in the pool and on the field and all those things. But.
So do you cover all the games, or do you guys get it rotated around, or how does all that work?
So for basketball, Dr. Hosey and I are at all the home games, and then we split the road games, and then we're both at all the tournament games, you know, SEC and NCAA games.
As far as these athletes go, I mean, they get into a routine. They are so highly tuned to do what they do. Any little thing can throw them off. So besides the actual treatment, the best thing I think you can give these guys is reassurance. Is that fair?
It's definitely fair. I mean, you deal with a lot of different personalities. Obviously, you've got the players who have a major injury and want to just keep playing through it, to the ones that, like you said, you know, need some reassurance. And there are a lot of different ways we do that, between sometimes just examining somebody and say we're sure that it's fine is enough for reassurance. Sometimes we have to get some tests to kind of prove things are all right. Sometimes we got to talk to their mothers and agents and all those things, but whatever it takes to do right by them is what we need to do.
That's been one of the biggest changes in what you do. Besides, obviously, you're a professor here as well, the knowledge that you have, and then the tools you have to help get these athletes back.
Yeah, a lot of things have changed. You know, ultimately the end goals are the same. We want to keep the athletes healthy and do right by them by making sure that it's safe for them to participate in sport. And then, you know, the ones that are not able to play, we need to do whatever we can to get them where they can play as soon as possible, as long as it's safe for them to do so.
How is the whole dynamic between when you have to go to a coach and say, Coach, I don't think he can go?
Well, I've worked with a lot of great coaches, and most of them are very reasonable people. You know, they're smart people, and they understand that it's not in their best interest to do things that aren't in the best interest of their athletes. But obviously there's situations where there's some give and take on what we need to do. You know, is it best for somebody to play through an injury, or is it best to give them a couple weeks to get healthy so they're ready for the end of the year? So a lot of those discussions take place with different coaches, and honestly, they're mostly incredibly good people, and most of them have the athlete's best interests in mind as well.
Absolutely.
They wouldn't be where they are.
And the thing I want people to realize is that it's not just these world-class athletes, but anybody that comes here to UK HealthCare Orthopaedics gets that same kind of treatment. Thanks, Doc. We appreciate the time.
Appreciate you.
Great being with you. You can contact Dr. Mair and his whole staff. It's a great staff here at UK HealthCare. You go to ukhealthcare.com/ortho. And we'll see you next time on Everyday Kentucky.